My name is Brian, and I'm a Patient Advocacy Manager here at AiArthritis. In our previous two videos, we've talked about the 340B drug pricing program, explaining what it is and why you should care. Now I'm going to highlight an example of it. So I've mentioned that the 340B program isn't working as originally intended and has had some issues with the program's integrity and financial oversight. How so exactly? Well, one infamous example of 340B being exploited is the Bon Secours Hospital system in Virginia. This case was highlighted in a New York Times article. The Bon Secours Hospital system had a hospital in a poor neighborhood in Richmond, Virginia, called the Richmond Community Hospital. In the neighborhoods surrounding the Richmond community, more than half of the households do not have a car, according to Virginia Commonwealth University, and the next closest hospital takes almost an hour to reach by public transportation. So the Richmond Community Hospital is vital to the health and well-being of residents in that neighborhood, especially in an emergency. This struggling hospital closed its ICU in 2017 and consists of little more than a small emergency room and a psychiatric ward. Its MRI machine would frequently break and be out of service for weeks at a time, and they have no kidney or lung specialists or even a maternity ward. However, this hospital had the highest profit margins of any hospital in Virginia and would generate as much as $100 million per year. How are they able to do that? Well, the vast majority of Richmond Community's profits came from the 340B program. Rather than reinvesting 340B savings in this poor neighborhood and improving the quality of care for its residents, Bon Secours invested heavily in the city's wealthier neighborhoods, where patients are more likely to have commercial insurance that reimburses the hospital at a higher rate, while simultaneously slashing services from the Richmond Community Hospital. They were able to do this by building clinics in wealthy neighborhoods that, on paper, are extensions of the Richmond Community Hospital, which is a 340B covered entity. Overall, this was an instance where profits for the hospital were placed over the health and well-being of patients served by the Richmond Community Hospital. This hospital ultimately just became a loophole for Bon Secours to make profits and invest heavily in wealthy neighborhoods, while the residents of this poor neighborhood continued to experience a critical lack of care. Had things worked successfully, funds from the 340B program would have gone directly back into the Richmond Community Hospital, and their services would have improved for residents in this neighborhood. However, this was an instance where this did not happen, and the 340B program was not working as originally intended.